I plan to rename our research area as Research and Advocacy. Ava Grunfeld will continue to be Vice Chair, although her second term in this role will conclude at the end of 2018, so we will shortly be starting to recruit into this position. We need to continue to focus on our research activity, grow our research income and our research outputs, and increase the recognition of the important research taking place across this department. Our faculty, as I've said, includes some of the global leaders in family medicine research, and I want to build links with other great centres of family medicine research around the world, as well as strengthening our links with other areas of clinical medicine and public health here at the University of Toronto. We need to build on our strong base. I want all our residents to be research competent on completion of their training. I want all of our faculty to be at least research aware and open to involvement in research activity. I want to work with the university's graduate schools to grow the opportunities for more enrolments in master and PhD programs for our family medicine residents and for family doctors and those who'd like to do research with us, including welcome visitors from overseas. We also need to be using our research for advocacy. Advocacy for the role of family medicine as the foundation of health services in Canada. Advocacy for the need for greater investment, both in clinical family medicine services and in family medicine research. Advocacy for family practice as the ideal research location to generate the evidence for the delivery of 21st century healthcare. And advocacy for how we translate the findings of our research rapidly into clinical practice. You and I know that family practice systems are the natural place for health and medical research and exploration, and we need to let the rest of the world know that too. Fortunately, we're already a long way down this path. Utopian is one of the world's largest practice-based research networks, and we should be a site for an increasing number of clinical trials. And the aggregation of electronic medical records for our utopian practices provides an incredible resource to enable us to understand the health and healthcare needs of our population and to inform policymakers and focus health service investment. I'd like to see all our faculty members engage with Utopian, their practice-based research network. And I'd like to be even more strategic in looking at how we use the Utopian resource. I'd like to work with you to create the annual Toronto Health Report using Utopian and other data sources to produce an annual report on the state of health of the 6.4 million people of the Greater Toronto Area, highlighting the contribution of family medicine to the health and well-being of the people of our city, and tracking over time to see the impact of government policies and innovations and changes in health practices on the health and well-being of the population we serve. Our library is one of the few standalone collections of family medicine and primary care literature in the world, and it will sit under research, and we will look at ways that our library can expand support and contributions for the research mandate of our department. I've asked Ava to work with our research leaders on what makes research of the Department of Family and Community Medicine distinctive, and to determine those areas of primary care research where we're a leader. What are the great global health and medical research questions that we can help to answer? How can we improve knowledge translation into clinical practice? And what are the questions that we can answer which others cannot? I'm keen to also increase opportunities for research partnership with industry. As I said, I'm keen to see at least 5 new endowed chairs, and I'm keen to hear from you about what the areas of focus should be. Perhaps global expansion of family medicine, prevention and management of chronic disease and mental health and comorbidity and complexity, our contributions to healthy ageing, opportunities to expand clinical trials in primary care, the role of innovations in digital health and genetics in family medicine.